Salam and welcome. October is Breast Cancer Awareness Month globally, and as well as here in South Africa, we are sharing or highlighting the issue of breast cancer. Breast cancer is one of the most common cancers worldwide, and one of the reasons for that is because of advances in detecting breast cancer at an early stage. Remember that for all types of cancer, the earlier that it is found, the better are your chances for recovery and for improvement. And sadly, this once again has got to do with money. The more money you have, or the first world countries, you will find that the detection rates are much quicker, much higher, because they've got all the resources for it. Whereas we in South Africa, or on the African continent, and some countries in Asia are struggling, even in the Middle East, whether it's Afghanistan or Pakistan, where cancers are detected much later. So join me in this series of episodes as we're going through breast cancer. But remember that I will explain the basics of breast cancer, but initially we need to understand what cancer is, because the things that cause the cancer, or cancer as a diagnosis, is similar whether it is cancer in males or females or children, and whether it is breast cancer or prostate cancer. Breast cancer is shown with a pink ribbon, prostate cancer with a blue ribbon, and so on, right? But let's go through this, and I've compiled this book, alhamdulillah, by the grace of Allah subhanahu wa ta'ala, called 365 Days of Combating Breast Cancer, which is sharing some motivational quotes by those people who have survived breast cancer survivors, and to see how we can motivate ourselves and the patients as well as the caregivers over a period of 365 days. So the title of the book is called 365 Days of Breast Cancer. And the reason why I have compiled this book, because studies have shown that it is very important that we program our brain. So the reason for 365 days is that you need to program your brain for mental toughness, right? And these are inspirational insights that I have produced, and copies of these books can be obtained from drahmedadam.com. These are just simply online books, and they are not available at the moment in paperback or hardback format. Let's go further down. So the philosophy here is that cancer can be beaten. You need to fight cancer, but it's got to be a multi-pronged approach. That means you fight cancer with the help of your medical doctors, your medical team, your oncologists, your physicians, and your family, your caregivers. But the most important battle is the battle that's occurring in your brain, in your own mind. Because no matter how much care you got around you, if your mind is not focused on combating or fighting this cancer, then your surrounding teamwork will not be that cooperative or responsive to your needs. So the first battle that you need to fight is the battle in your brain. So even though this book is called 365 days, it's the intention here is that the patient or the caregivers read through one quote per day. But you can read 2 quotes per day, or if you read 3 quotations per day, then you can finish this book simply in 1 month's time. Right, let's go further down. And we're coming to the index or the topic pages, right? The book is made up of, I'll tell you how many chapters there are in this book. It's made up of 18, okay, that's including the appendix, right? 18 chapters. Here it starts with some books that I've got available online, a brief bio about myself, and then chapter 3 starts with the introduction itself. This is basically just the preface or the forward to the book. Then the introduction starts on page 14. Then I'm going to look at topics of breast cancer basics, the treatment of breast cancer, the outcomes that one can expect, some statistics, the psychology of breast cancer. This is very, very important, because as I mentioned, breast cancer basically is a battle that you're fighting in your brain. This is a battle in your brain of people in your mind. Then we're removing some common myths that are associated with breast cancer, then a summary of hope and deep thoughts from others, and the benefits of breast self-examination. Please join me for this particular session, where I will show you and demonstrate physically how you do a breast self-examination, right? By demonstrating physically what is actually happening. Then what do you say to someone who has cancer? And then 365 days of programming your brain for mental toughness. And then on page 445 of the book, there's bonus deep thinking thoughts. Appendix 1 got a brief summary of countries with the highest number of cancer cases. Appendix 2, what are the top 10 countries with the highest rates of cancer? And Appendix 3, what are the top 10 countries with the lowest cancer rates? And cancer has been in the news recently because of famous celebrities as well as royalty. King Charles has been affected with cancer. Princess Kate has been affected with cancer. And there are so many Hollywood celebrities and Bollywood celebrities who have been affected by cancer, different types of cancer, whether it is throat cancer, cervical cancer, pancreatic cancer, prostate cancer, or various different types of cancer. There's also a cancer in children, which is known as leukemia, or other different types of cancer. So briefly, before we end today's session, this is Breast Cancer Basics Part 1 for today. Part 1, breast cancer, back to basics. What I will explain as my philosophy is I like to make everything very, very simple without any complications. So remember, we are here to fight cancer together, you and I together with your caregiver, your family, and your friends, and your support structure. Right, so introduction. Breast cancer is the most common cancer diagnosed in women in the Western world. And remember, make note of that, in the Western world. We are not talking about developed countries or developing. We are talking about developed countries. We are not talking about developing countries or third world countries, right? So in the Western world, the reason why it is the most cancer diagnosed is because of the greater facilities they have, the greater amount of resources that they put in diagnosing the cancer, whether it is through mammograms or active advertising on breast self-examination from an early age. Right, so coping with cancer is a cause of extreme stress for the patients and their families, right? When cancer affects, as a medical doctor, I can tell you there's two types of things that affect the entire family. One, if you are suffering from financial difficulty or poverty, or you've got high levels of debt, that affects every person in that house, because the only thing you're talking about the whole day is about money or the lack of money. So with difficulty of finances, that is one thing that affects the entire family. And the second condition that affects the entire family is a chronic illness like cancer or a disability where a patient is handicapped or needs a wheelchair. So just for the mere fact of going out of the wheelchair, the entire family gets involved. You want to go for holiday, okay, how do we carry the wheelchair? Who's going to push the wheelchair? So there are certain chronic conditions in which the entire family's life is affected. And cancer, breast cancer or any other type of cancer, affects the entire family. Right. So let's look at this quotation from the psychological aspects to consider in breast cancer diagnosis and treatment. And that's from the journal, The Current Oncology, March 11. Anxiety, distress, depression, and PTSD, post-traumatic stress disorder, are the most frequent psychological disorders in breast cancer patients. Cognitive disorders and sexual dysfunction can also be important in younger and older patients. Younger and older patients show different characteristics of these disorders and different strategies of managing them. And this is very, very important, especially in married couples where there is a major change in the psychological change of both the husband and wife insofar as intimacy or marital intimacy is concerned. And many people tend to forget that component, because if you have a problem with the breasts, or if you have a problem with the womb cancer or cervical cancer, this component of marital intimacy has a major, major psychological problem on the marriage itself and on both partners. So that brings us to the end of the introduction. Join me in this series and please share this with others, because as South Africans, we need to empower ourselves with knowledge. And one of the best way of empowering ourselves with knowledge is to share this, because my mission is to make South Africa a better place for all of us, so it is a better place for our children, our grandchildren, and the future generation of people. Stay well, stay focused, look after yourself. Alhamdulillah Rabbil Alameen.